Hello, everybody, and welcome to Ask Dr. Bob. That's where people with diabetes, their friends, their loved ones, whoever, can call in or virtually connect and ask me questions. And my name is Dr. Bob Gabbay. I'm the Chief Scientific and Medical Officer for the American Diabetes Association. And it's my pleasure to answer your questions. And we already have a whole bunch of questions. And our theme today, appropriately enough, is thinking about the holidays and diabetes management. Can often be a tricky time. And so, share some tips, some thoughts. Without further ado, I will jump in. And so, here's the first question. How can people with diabetes pro- uh, properly enjoy holiday foods? Any tips that you can offer? Well, yes, I have a number of tips, and so let me share them with you. You know, the holidays, can be a tricky time. We'll talk about stress and issues in a few minutes, um, but there's also this, you know, very much associated with food and food and diabetes. We all have to eat, but we want to make some good choices. So, um, at the simple level, I'll give you three tips, and then I'll get more specific. And so, three tips is one, think about portion size. So you can eat, a little bit of anything, more or less, um, but a little bit. So take only a small amount. And that way you can enjoy it. You don't have to fully deprive yourself because that's no fun. So if there are holiday cookies around, have one or two. That's okay. Don't have a whole bunch. So, one is portion control. Second is if you are taking insulin to manage your diabetes, then you want to think about how to adjust your insulin for the extra carbohydrates that you might be consuming. And that's something to review with your healthcare provider to make sure you understand what to do. And the third big tip is around activity. So, one of the things you can do during the holidays, because yeah, you might eat a little bit more than usual, do a little more activity than usual. Whatever it is that you like to do a bit more, and that can balance some of the effect of food. Okay, so let me move along to the next question, um, and that is about diabetes friendly holiday recipes. So we may be entertaining, we may be bringing something to our friends and a loved one's place. What are some good recipes? Well, turns out that the American Diabetes Association has a wealth of these. And all you have to do is go to our food hub. And that is a simple website, www.diabetesfoodhub. That's all one word, diabetesfoodhub.org. So look for our Diabetes Food Hub, lots of good recipes. Someone else asked for more tips. And again, feel free to throw questions into the chat because as we have time, I'll try to answer them. So, what are some other tips? And here's where I'm going to give you three, strategies that you can use during the holiday. First of all, um, if you are at home and you're having people over, take control of the kitchen and cook something that you know would be healthy and diabetes friendly. Again, the Diabetes Food Hub is a great place to find some of those recipes, but take a little control of the kitchen if you have the opportunity. Now, um, what if you're not the cook and you're going to somebody's place? What can you do then? Well, when people say bring a dish, but bring a healthier dish. That way, there's at least one thing there that's actually going to be healthier, a healthier choice. And so you can concentrate on that. And if most of your festivities around the holidays are going out, which again we'll talk about later about being careful, um, if most of your festivities are about going out, then uh, try to make your home a safe zone. Try not to keep a lot of tempting foods that you're trying to not eat home. Just sort of clear your house of most of that kind of stuff. You go out to people's places, you can enjoy them in moderation, but at least you don't have the temptation at home. So those are three practical tips. Taking control of the kitchen, bringing a dish if you're going out, and making your home a safe zone. Okay, so here's the next question. Does mental health play a big role in my eating habits during the holidays? Absolutely. And it's not just the holidays. Mental health and food are connected. They're connected in a lot of ways. Uh, I'm sure many of you have heard of stress eating. Yeah, we've all been victims of it at one time or another. And so, you know, first is to ask yourself, how stressed are you? Um, what are my triggers? If you're home, making sure you don't have those foods around can help when you do feel stressed and you want to stress eat. Well, don't have the things that can be an issue. And then think about how you can reduce stress because that's really something important. And I'll get to that in a second because the next question sort of leads right into that. So let me move to the next question. What are some different ways I can manage the holiday blues to keep my diabetes management in check? Well, the holidays can be a challenging time. Some people feel the pressure of family and friends. Um, some people don't have their family and friends around, and that can be upsetting. So, what are some things you can do? Here's something, and you might even try this right now. Think of three things you enjoy doing and jot them down. You can list more than three. What do you enjoy? What's fun for you? And think about doing something off of that list over the holidays. So that's one idea. I've got three for you. The second one is to think about what you have gratitude for. This can be a difficult time for a lot of us. And just thinking about what you have to be grateful for. Um, and there's always something. And reminding us of what we're grateful for can really help us deal with stress and make us more resilient. And the third idea, is think about some of your successes over the past year. They don't have to be big successes, they can be small ones. They can be, I connected with my healthcare provider this year once or twice or whatever it was. Or I took my medicine on a regular basis, or I exercised whatever amount. Whatever you did, it was better than not doing anything. Think about your successes. And that's another way to build resiliency. Okay, next question. What are some diabetes friendly ways I can help manage my child's diabetes and still give them a joyful holiday? Well, parents, you want your kids to enjoy the holidays. It's a wonderful time. Um, and you know what? So kids, there's the food part, and that can be challenging with diabetes. And we talked a little bit about some strategies there. But, many times what your children want most of all is your time. And so give them a little bit of time and do something fun with them, something they would find fun. If you don't know, ask them. Um, And it depends on the age, obviously, what that'll be, but that can really help them have something special for the holidays. You could even start creating a tradition. During the holidays, we will do X, and kids often love that, and they get excited about that next year. So there's a there's an idea. Um, let me also take a moment because I got a number of questions about the new COVID variant, and what do we do? How do we deal with this? Well, what do we know so far? We don't have all the answers, but I'll tell you what we know so far. We know that it appears to be more contagious, um, but it doesn't seem to be more severe. So if you do get it, the new COVID variant, you're not necessarily any more likely to get more severely ill. Now, for people with diabetes, obviously need to be careful. And what we also know is that, and this is really early information, but certainly Moderna and Pfizer vaccines seem to protect against Omicron, the Omicron variant. Again, this is evolving. This is as of today, uh, but that's good news. So, what can you do? Well, first of all, if you haven't gotten vaccinated, please think about getting vaccinated. Talk to your healthcare provider, and if you're eligible and due for a booster, think about the booster because people with diabetes are at high risk. Remember, up to 40% of all the people that have died from COVID in the US had diabetes. So, people with diabetes, really high risk, get a booster. Okay, here's a question. Um, I'm traveling this holiday. What are some of the safety measures I should consider? Well, um, with the spread and rising numbers of COVID, what are some of the things you can do? Remember, wear a mask. Wear a mask. Wear a mask, please. Uh, get your booster shot. Wash your hands regularly. Um, practice physical distancing. Um, and watch the people around you, particularly as we're traveling. If you know people are not all following what they should, not masking, whatever that might be, eh, take a step back from them. It's okay. uh, think of your safety as being important. um, the other question was, what should I pack with me as I travel for this holiday season? Well, I think there are a few things to keep in mind when you're traveling. First, make sure you have your medications and a list of your medicines in case you lose them. Way to check your blood glucoses, whether that's finger sticking or a continuous glucose monitor. Um, some planning around an emergency. If I lose my medicine, what's the phone number for my healthcare provider, pharmacy, etc. Those kinds of things. Bring some extra masks and think about N95 masks, particularly when you're traveling. N95 masks are higher rated masks that are even more protective than the regular surgical masks. They're available at a variety of different places. Something to consider. Everybody doesn't necessarily need it, but think about that. And getting back to the food side of things, think about carrying some healthy snacks while you travel so you won't be tempted when you're hungry, inevitably, to get the foods that often when we're traveling, what's available isn't super healthy. Okay, here's one more question I have, and I'm going to see if we have questions from you. So throw it in the chat. Um, you know, another person is concerned about getting COVID, and what do I need to have at home? Well, first of all, make sure you have a supply of your diabetes medications. Have something to treat a fever, uh, Motrin, acetaminophen, whatever your healthcare provider has recommended. Have some of that. Have plenty of liquids around. Um, Make sure you have some food in case you can't go out. Be able to measure your blood glucose. Make sure you have that information. Um, and then think about what you might need if you're sick. And so, one of the things that I think are helpful and I have at home is cough medication. It's good to just have. Doesn't expire for a while. You can just keep it in case you'll need it. So again, you know, having your medicines, having something for a fever like Tylenol, liquids, food, blood glucose testing, and cough medication. Um, and that's a nice little kit for you to have available just in case. So I'm going to see if we have some questions, and we do. And as a reminder, I'm Dr. Bob, and this is where you get to ask questions of me about your diabetes. So excuse me, and I'm going to get up close and personal here. And so Marie Renee asks, do I recommend checking blood glucoses more frequently during this time of year? Yeah, I think that's a really wonderful idea because we're often, during the holidays, we're often outside of our normal routines. And whenever our routines change, that's when it's good to get more information about how you're doing with your diabetes. So checking your blood glucoses more often is a great idea. Okay, let's see what other questions we have. Uh, oh, here's a good one about COVID. Does how long you've had diabetes uh, have an impact on COVID and whether you'll how you'll do if you get sick? Well, I would say not really, with a caveat, with an exception. So people that have had diabetes for a long period of time may have or are more likely to have complications of diabetes. And so that we know that diabetes, along with hypertension, um, congestive heart failure, or any kind of heart disease, which can be a complication of diabetes, increases the risk of bad outcomes with COVID. So if you have what we call comorbidities, other chronic diseases, along with your diabetes, that can put you at greater risk. So I think this is all the time we have today. And I want to thank you for joining. My name is Dr. Bob Gabe. I'm the Chief Scientific and Medical Officer for the American Diabetes Association. And every month we have this program called Ask Dr. Bob, where you can send in your questions and I'll answer them on this program. So tell your friends, tell your loved ones, whoever, and please be safe. Have a wonderful holiday and look forward to seeing you next year. Take care. Be well.